Well, welcome everybody. I'm Richard Catlow, co-president of the InterAcademy Partnership. And under the umbrella of the IAP, more than 140 national, regional and global member academies work together to support the vital role of science in seeking evidence-based solutions to the world's most challenging problems. Today, as you know, we launch a major report on health in the climate emergency, a global perspective. Now, I think we're all aware that climate change is a huge challenge, possibly the greatest currently faced by the global community. And we are familiar with many of the risks that it presents, for example, regarding extreme weather events. But the enormous issues relating to global health are perhaps less well understood. And so I think the IAP report launched today has a crucial role to play. The report is the outcome of a 3-year collaborative global project between the InterAcademy Partnership and its regional networks in Africa, Asia, the Americas and Europe. More than 100 scientists from over 50 countries have contributed to the project, and I would like to thank all these scientists, as well as our peer reviewers, and of course our member academies, for their work and commitment to this project. At present, the World Health Assembly is taking place in Geneva, this year on the theme, Health for Peace and Peace for Health. It's clear that this vision will not become a reality unless the causes and consequences of climate change are addressed. The climate crisis is indeed the single biggest health threat facing humanity today. It's therefore timely that science academies from all around the world have come together to collect and review the existing scientific evidence. What they have found is that although the scale, the nature and timing of adverse effects on health vary within and between regions, there are common challenges that can and must be addressed. Today's webinar will present the major findings and discuss solutions for the various challenges. Collectively, we must emphasize health as a priority in tackling climate change. I would like to thank all contributors for their engagement and invite the audience members to be involved via the Q&A tool. And we also welcome longer-term interaction with you during the next months as IAP actively engages further with the scientific and health communities, with policymakers and with other stakeholders. Now, Johanna Mogwitz, IAP Project Assistant, will now introduce you to today's agenda and explain in more detail the technical setup of the webinar. So over to you, Johanna.
Thank you, Richard. So before I hand over to my colleagues who will then present the report, I would just to quickly give an overview of our agenda for today. So in the first half, around 40 minutes, we'll be focusing really on our new report. We'll present the report and also look into more detail on sustainable food systems and science policy linkages. And then in the second half of our webinar, we'll go into conversations, discussing our report with people both who were involved in the project, but also with people from outside. So this is the agenda for today. And just to let you know how you as the audience can get engaged with us. This is a webinar, so we unfortunately cannot see or hear you, but we would really like to encourage you to ask questions using the Q&A tool. You can see the symbol at the in the lower part of your screen, and you can also comment on other people's questions or upvote questions. Now, we don't know who you are really in this webinar, but to still somehow get a feeling of who is in the audience, I would kindly ask you now to fill in a little poll that we have prepared. The poll will come up on screen in just 1 second. So if you could just quickly respond to those 2 questions, what is your role and where do you come from? So we just get a feeling of who's joining us today, who is in the audience. That would be great. I'll just give you a few seconds to fill this in. Okay, the answers are coming in. Just a few more seconds so we get the majority of you responding. Okay, not quite all of you have responded, but I think I will just close the survey now and also share the results with you. So as you can see, we have quite a diverse group of people here today, many of them researchers, both on public health, but also on climate. We also have a few members of our academies, but it's also nice to see that we've really also quite a large percentage of audience who is not from our own academy. So good to see that we have a lot of guests today. That is great. Also a few media representatives and representatives of NGOs and international governmental organizations. Now, as we scroll down to see where people come from, we have quite a large group from Europe, but also people joining us from Sub-Saharan Africa, the Middle East, North America, and Latin America. Also a few from Australia and the Pacific. This must be a very inconvenient time for you. Thank you for joining anyways. And with this short overview, I would now like to give the word to Volker Termöhn. Volker Termöhn is Special Advisor of the InterAcademy Partnership and co-chair of this IAP project on climate change and health.
Dear participants, the idea to take up the issue of climate change and health and look at it from a scientific perspective was first suggested to IAP a few years ago by its regional network for Europe, the European Academy Science Advisory Council. This was because policymakers in Europe were discussing climate change and its impact on Europe, but without including consequences for human health, such as on cardiovascular diseases, respiratory diseases, infectious diseases with vectors moving to previously cooler regions, different types of mental health problems. The European Science Academies therefore carried out a study on the impact of climate change on health in Europe, bringing scientific evidence to the attention of policymakers and society. The report of this study received a lot of attention, not least from parts of the European Commission and from the European Parliament, where the Academy's findings were presented. This substantial interest in the report and positive response to it led to the expansion of the European study to a global level, and in this way to our present IAP report. With the financial support from the German Ministry of Science and Education, IAP at the end of 2019 could start a global project on climate change and health. IAP invited, through its respective regional networks, outstanding experts from Africa, Asia, and the Americas to collect evidence from their regions and arrive at a global picture of how human health is impacted by climate change. But the scientists also give their recommendation on what can be done to alleviate the impact. My colleagues will shortly present to you specific findings of our global study on climate change and health. But I can summarize the evidence by saying that we, as the world community, risk the progress of health which has been made worldwide in recent decades, if the impact of climate change and human health is not taken very seriously, and if no decisive action is taken, we will face grave challenges in the future. The sooner and more decisive we act, the better. The good news is that there are already many instruments at our disposal, and that science has provided a good groundwork of understanding in relevant areas which would allow us to act. I would like to say a few words on the methodological approach we took. Over the course of the project, the scientists from our networks in Africa, Asia, the Americas, and Europe collected the evidence of the climate change and health linkage for the countries in their regions. They did this with agreed common starting points and a set of specific questions combined with consistent quality assurance throughout. In the work process, we focus on collective and customized solutions and explored policy actions. For this, we engaged with policymakers and other stakeholders earlier. We did everything we could to enable transboundary, multidisciplinary, and inclusive scientific discussions. We made an effort to involve younger researchers to also build intergenerational connections. In taking an evidence-based approach to tackle the priorities for health equity, and climate justice, the academies were seeking to identify where there is consensus, where are evidence gaps which need to be filled, and where issues are still controversial. Last but not least, we are committed to substantial follow-up work on national, regional, and global levels to inform policy, innovation, and practice. To inform society and policymakers is still necessary and urgent, since despite accumulating evidence, the impact of climate change and health has not yet become a major focal point in global policy decisions. A relatively recent example of the lack of recognition of the challenge is last November's Glasgow Climate Pact, which came out of COP26. It recognizes rising temperatures and extreme weather as social, economic, and environmental stress, but it ignores their catastrophic effect on human health and well-being. I hope you will have a lively discussion on this topic today, and I am now looking forward to the presentation by our colleagues. Thank you. Sorry.
Thank you very much, Volker. And with this, I would like to give the virtual floor to Andy Haynes. Andy Haynes is the other co-chair of our IAP project on climate change and health. And he's also Professor of Environmental Change and Public Health at the London School of Hygiene and Tropical Medicine, with a joint appointment in the Department of Public Health, Environments and Society, and in the Department of Population. Andy will present to you the main findings of our report, and you will do so through a recording to be sure that there are no internet glitches, which I will share with you now.
What I'm going to do is provide an overview of the Global Synthesis Report from the InterAcademy Partnership. You've already heard in the introduction about this. What I'm going to do is give you some examples of how climate change is affecting health and could affect health more extensively and more seriously in the future, but also briefly discuss some actions that could be taken either to adapt to climate change that we can't prevent, or to mitigate climate change, to cut greenhouse gas emissions. So as you know, the project on climate change and health has been going on for 3 years. It's based, the first installment of that was the regional report for Europe, which was published in 2019 and helped with the scoping of the project. And then there have been the 3 regional reports for Africa, Asia, and the Americas, which provide an overview, a snapshot really of the current situation, and they present the science-based recommendations for each of these regions. And then the report we're talking about today is the Global Synthesis Report, which highlights some of the regional similarities and differences. It provides advice for decision makers for implementation at different levels, different spatial levels, global, regional, and national, taking into account local context and requirements. So this infographic summarizes what is quite a complex picture, how climate change impacts on human health. And you can see at the top the increasing levels of carbon dioxide, which of course is a long-lived greenhouse gas, and short-lived climate pollutants like methane, for example. or black carbon. And these contribute to the rising temperatures that we're seeing now at 1.2 degrees centigrade global average temperature increase compared with pre-industrial times. And this in turn increases sea levels, rising sea levels, causes an increase in the frequency and intensity of extreme weather events. And through a range of different demographic, socioeconomic and other environmental factors, these have an impact on human health through a range of pathways. So, of course, these are mediated through these different pathways to varying extents around the world. It's not a uniform pattern, of course. And in general terms, those populations that have contributed least to climate change are bearing the brunt, or like to bear the major impacts of climate change. And you can see the exposure pathways range from the most direct on the left, extreme weather events, floods, droughts, extreme heat, through to the less direct, the air quality related, for example, to increased wildfires, increased respiratory allergies because of increases in pollen, changes in water quality and quantity, which can affect a whole range of different diseases related to water availability, food supply and safety, likely increasing undernutrition, but also increasing some types of food poisoning, for example. Changes in the distribution of vector-borne diseases, malaria, of course, being a major global killer, but dengue is a very pervasive mosquito-borne disease, and the transmission of dengue by the mosquito host has been increased as a result of climate change, increased vectorial capacity, as it's called. And then finally, social factors. So increasing poverty, population displacement, and probably conflict as well. The most difficult to estimate in terms of numbers, but likely to be a very, very major pathway by which climate change impacts on health. So this just gives you one example. This is how, as climate change goes forward, and if we reach, say, global average temperature of over 2.5 degrees, which could occur later this century, but then about 1 billion people would be exposed to such extreme heat that it would prevent moderate physical activity in the hottest month, even in the shade, certainly safely. And this would, of course, be one of the factors that would drive more people back into poverty. And you can see how that yellow area expands as the temperature increase goes on. And that, the rate that happens, of course, will be determined by the decisions we make over coming years about the emissions of greenhouse gases. We know that already climate change is having an impact on heat-related deaths, as shown by this recent paper published last year, based on data from over 700 sites in 43 countries, led by my colleague Ana Cabrera. What you can see is how, based on this data, the investigators were able to say that about a third or more than a third of total heat deaths over recent decades could be attributed to human-induced climate change, not just natural variability, but these deaths would not have happened in the absence of human-induced climate change. But you can also see from the map that there are big gaps in the data. So there's no data for much of Africa and Asia. And these are areas where we're likely to be seeing an increase, a particular increase in heat-related deaths. So important gaps in the evidence, but worrying evidence already of an impact. We also know that, as I've said before, many mosquito-borne diseases could increase in a hotter world. And this slide summarizes the results of a recent paper from some of my colleagues. And what they looked at was the extent to which climate change would impact on malaria and dengue. And they suggested that by 2100, due to rising temperatures and population growth, 4.7 billion additional people could be at risk, compared with a baseline of 1970 to 1999. 4.7 billion in the high emission scenario and 2.4 billion in a very low emission scenario. So it gives you an idea of the difference really between high and low emissions futures. We also know that there's big impacts of climate change on food production. This map shows you where crop yields could decrease over coming years. And this is the +3 degrees scenario. So depending on the actions that we take, could be towards the end of the century. And you can see that there are some parts of the world where increases in yield might occur, but we don't know how long that would go on. And we don't know whether populations living in tropical and subtropical regions would be able to afford to buy food on an increasingly competitive global market. So this could have very serious implications for nutrition, including stunting in children, which we know has a lifelong effect. So their short stature, but also their IQ is affected, and their future prospects for earnings, for economic independence are also affected. But we know that climate change isn't just affecting, or won't just affect physical health, it will also affect mental health. And for example, after exposure to major wildfires or floods and droughts, there's an increase in common mental disorders, and these can persist for quite some periods after these extreme events. There's this concept of solastalgia, which is really the grief caused by environmental change. It's been experienced in communities as diverse as living in the Arctic, which have been displaced or seen their local environment rapidly degraded. Australian farmers have lost their livelihoods from drought and so on. And then this concept of climate anxiety, which is increasingly being manifest, particularly amongst young people who have natural concerns about a hazardous and uncertain future. Perhaps one positive note, though, is that there is some evidence, and it's still early stages, but that maybe climate action may be help to alleviate some of the climate anxiety that many, particularly younger people, are understandably feeling at the moment. So getting actively engaged in activities to try and reduce the impacts of climate change. So what are these actions that we need to take? Well, there are two broad types of actions. There's the adaptation, which is action to manage the risks of climate change that we can't prevent. We're already at 1.2 degrees, so we have to adapt to some degrees. And then mitigation, which is action to cut emissions, cut greenhouse gas emissions and other climate active pollutants that cause climate change. And adaptation includes better flood protection, better disaster management, maybe heat wave early warning systems, disease early warning systems, and so on. And mitigation is about cutting emissions from fossil fuel burning for energy through clean renewable energy, energy efficiency, sustainable transportation, and also more sustainable food systems, because we know that food systems are responsible for about 25%, something of that order, of greenhouse gas emissions. Of course, methane comes from livestock and to some extent from rice paddies as well, other sources. So what can be done? What can cities do, for example, to adapt and mitigate climate change? So we know that over 50% of the world's population lives in cities, and urban populations are expanding in many parts of the world. And there's lots that cities can do through accessible, efficient public transport and active travel like walking and cycling, providing that's, of course, done safely and separated as far as possible from motor transport. That brings benefits in terms of reduced air pollution, but also increased physical activity. Universal access to clean, low carbon energy, both through the grid, but also domestic sources of energy. Safe access to green spaces. We're now understanding that green spaces are important for physical and mental health. So ideally, people should live within a few hundred meters of green space in cities. And of course, housing improvements like an improved water and sanitation that's resilient to climate shocks. These are the kind of steps that should be taken to reach a 1.5 degrees centigrade world. Unfortunately, that possibility is rapidly receding, but we can still keep to well under 2 degrees, which is the sort of secondary target of the Paris Agreement. So we need to sustain the growth of renewables, clean renewable energy like photovoltaics, stop building coal power plants, stop selling fossil fuel powered cars within the next less than 15 years, develop a vision which includes aviation and shipping, which have been notoriously difficult to include in climate mitigation targets, ensure that new industrial installations are low carbon, and these other actions as well on the left side of the slide, including best practice in agriculture, more efficient agriculture, but also less dependent in high consuming countries on the consumption of red meat, for example. So each of these can have benefits to human health if they're well designed. And let me just mention one or two of those. If we phase out fossil fuels, we can potentially avert millions of deaths annually from reduced ambient air pollution. This is one estimate suggesting over 3.5 billion annual deaths based on 2015 data. And you can see where those deaths occur from the map. So China, India, Europe, North America, less so over Latin America and Africa because they burn less fossil fuels. But obviously, if those populations start to burn more fossil fuels, then those air pollution deaths would go up. So as we move towards clean energy, we could get the benefits not only of reducing the risk of dangerous climate change, but also of reducing air pollution, which will bring near-term benefits to human health, reducing the risk of stroke, heart disease, respiratory diseases, and so on. And this study shows the public health benefits of the Paris Agreement based on an analysis of data from 9 countries. And you can see the benefits that would accrue if these countries put in place, honoured the targets were in their nationally determined contributions. These are the contributions that each country makes to the Paris Agreement. And if they tailored these to actually specifically improve health, you can see there would be big benefits from reduced air pollution in the green, variable according to the country, as you'd expect. Improved diets, a big win there, because dietary intake, of course, is such an important determinant of human health. And increased physical activity as well through more walking and cycling, more use of public transport rather than the private car. And you can see very large potential health benefits, 1.6 million deaths prevented from air pollution annually by 2040, 6.4 million diet related, and 2.1 physical inactivity related deaths. So big potential benefits from the implementation of the Paris Agreement goals. And then we also need to put in place much more climate resilient and sustainable low carbon health systems. We know that the healthcare system itself is responsible for about 5% of emissions on a global scale, more in some countries like the US. At the COP26, of course, 52 countries committed to building health systems which can withstand the impacts of climate change better and are also low carbon and more sustainable. And 14 countries set a deadline of 2050 or earlier, by which their health system would reach net zero emissions. And on the top left here, you see where these emissions come from. It's taken from the National Health Service England. And you can see that many of these emissions are Scope 3 emissions. These are indirect emissions. Energy at health facilities is important, electricity, but even more so, the carbon emissions in medical devices, in medicines, food and catering, transport, and so on. So need to not just focus on the health system itself, but also the supply chains and work with those suppliers to reduce their greenhouse gas emissions. So finally, the IAP project, you'll hear a bit more about this in a moment, but it very much focuses on policy, the need to support decisions through evidence-informed solutions for adaptation and mitigation, which both protect health and accelerate the transition to the net zero carbon economy, avoiding potential trade-offs and unintended adverse consequences. So, for example, if you don't make sure that the poor can afford clean renewable energy, then you can price them out of the market. You don't ensure that that healthy diets are affordable. Likewise, the poor can be disadvantaged. So designing these policies with equity in mind is really important. And coordinating policies across different regions, sectors, and governance levels will be essential to minimize and understand and minimize these potential unintended adverse consequences. But if policies are well designed and implemented rapidly, then there are big health benefits, as I say, not just from reducing the risk of dangerous climate change, but also the near-term benefits of moving towards a sustainable economy. Thank you very much.
Thank you very much, Andy, for giving this overview of the findings of our global report. And with that, we'll go into a little more detail of some of the aspects of the report. And first of all, I'd like to give the floor to Claudia Canales. Claudia is a plant scientist who is currently also Chief Executive of the Kirkhouse Trust. And Claudia is also Scientific Associate for this IAP Global Project. Claudia, the floor is yours.
Thank you, Joanna. Good afternoon. I would like to thank the organizers of the event for inviting me. The focus of my presentation will be sustainable food systems in the face of climate change. Sorry, okay, oops. sorry, so my first slide is an introduction on the current status of global food and nutrition security. In the last years, there has been a worsening of the situation, and in 2020, nearly 1 in 3 people, so 2.4 billion people in the world, did not have enough adequate food. At the same time, the levels of obesity are increasing everywhere in the world, and 13% of adults are now obese and nearly 40% overweight. And many populations are exhibiting at the same time several drivers of food insecurity. These include climate change, but also changes in demography, conflicts, and recently the effects of the COVID-19 pandemic. The main reason for food insecurity is the unaffordability of healthy diets. And as Andy said, unhealthy diets are also one of the largest contributors to global morbidity and premature mortality. This map shows the inequality in food and nutrition security in the world. And Andy also showed a map that indicated the areas of the world that will be most impacted by climate change in terms of food production. And you see there is a very large overlap. Half of the people undernourished live in Asia and over 1/3 in Africa. And there is also inequality in terms of gender. So in 2020, the prevalence of moderate and severe food insecurity was 10% higher in women compared to men. Climate change impacts food security in particular through food production because of the effects of drought, heat, and extreme weather events on crop yields, but also on the nutritional quality of crops, so on the content of essential nutrients such as iron and zinc. Climate change also affects the distribution and severity of agricultural pests and diseases, and will have implications for food safety due to the higher levels of toxins and microbial contamination of food. There is also inequality because the populations who depend on the land for their livelihoods will be particularly impacted, are already impacted, and these include indigenous people. At the same time, as Andy mentioned, food systems are very important contributors to climate change. The sector is responsible for about 1/3 of the human emissions. And of these, livestock production account for half of the emissions. Unhealthy diets rich in animal sourced products in more affluent countries, which import food, effectively displays the environmental and social costs of food production to food and feed exporting countries. And they also have information on the impact of a switch to healthy, sustainable diets that are mostly plant-based. And this will have very large co-benefits for both human health and the environment. And it's very important to consider the accessibility, affordability, and cultural acceptance of the sustainable diets proposed for their uptake and acceptance. For these reasons, mitigation and adaptation in food systems is critical to meet climate mitigation targets. It's important to have a food systems approach, so not only focus on production, but also aim to have a sustainable consumption and limit food waste. In terms of crop production, the emphasis is the development of heat and drought tolerant crops, improved nutrition in crops, in particular protein and micronutrient content, and improving the resilience of production systems. And this also including a larger number of underutilized crops. The main priority in the livestock sector is reducing their environmental footprint, and this is through animal nutrition and health. And they also mentioned it's critical to take a multi-sectorial policy action and coordination, since this impacts both land, water, energy use, and implies in health considerations. It's very important to integrate adaptation and mitigation interventions. And finally, it's important to remember a focus on vulnerable populations, and this requires addressing many crises that are experienced simultaneously. And with that, I'd like to thank you for your attention.
Thank you, Claudia, for this insight into the effects of climate change, specifically for the food security. Now, a second focus of the report has been science policy linkages, and this will be presented to you by Robin Fierce. Robin is the director of the Biosciences program of the European Academy Science Advisory Council, and he's the scientific director of the IAP project on climate change and health. Robin, the floor is yours.
Thank you very much, Joanna. Well, we've already heard a lot about the objectives and scope of the IAP project, and clearly that the scope is broad. Claudia is just now focused on one specific aspect for food and nutrition security, but of course there are many other aspects as introduced by Andy and described in detail in our report just published this week. A number of the other cross-cutting issues will be discussed later by our in conversation, separate sessions that you'll hear about it in a few minutes. My task today is to emphasize briefly some of the general priorities we've identified in the global report, drawing on the outputs across all of the themes in order to identify priorities to engage with policymakers and other stakeholders. So what are we saying in our global report? And this slide summarizes very generally some of the key messages. And remember, this global report is itself underpinned by 4 regional reports published over the last year or so, with large amounts of detail on individual regions and collective discussion about those. Well, our messages are that, as Andy has mentioned, climate change does affect us all, both in terms of physical and mental health. But the biggest effect is on vulnerable groups. For example, in low and middle income countries and others who are marginalized, at risk or already sick, mothers and children, elderly, migrants, indigenous people, for example. And as Andy said, many of these groups have contributed least to the problems of climate change. Well, the challenges are unprecedented, but so are the scientific opportunities to act with mitigation and adaptation solutions. And as you heard from both of the previous speakers, we must use both approaches, both mitigation and adaptation, and we must use them in a better integrated way. This is an issue for policymakers, but it's also an issue for the scientific communities who hitherto had rather acted in the separate silos of mitigation and adaptation. We need to bring those different communities together. A number of other points are made on this slide, but let me just emphasize the last one. Climate change is a global health crisis, but there are other global health crises, most particularly recently COVID-19. And the concurrent crises of COVID and climate change intersect in various ways that we describe in our reports. We begin to understand how the effects are amplified by one another. And I think we can also learn to use the rapid response that was mounted to COVID worldwide in preparing further to respond to climate change. Well, these general messages in turn lead to some quite specific recommendations to policymakers and others in our report. The ones listed on this slide pertain really to the generation and use of evidence. We conclude very strongly there is enough evidence to act now, and you will hear about some of the key themes where we can act in further detail from our panelists in the next session. Let me just emphasize a couple of things here. What one mentioned by Andy, health professionals themselves can take a key role to lead the wider discussions on climate change. But to do this, the health sector itself worldwide must be more ambitious, and it is becoming more ambitious in reducing its own carbon footprint, but of course compromising the quality of healthcare. And indeed, we're beginning to see that well-targeted mitigation activities in the health sector can improve healthcare in climate resilient health systems. And as Volker mentioned in his introduction, it's also clear that collectively we need to do more to demonstrate the importance of health as an issue in the broader climate change discussions. And we certainly hope that this can be done in the run-up to COP27 and COP28. Well, how do we use this evidence? An IAP recognises, of course, but it's not sufficient just to produce reports. We must use the evidence that we accumulate to stimulate further dialogue, but also action in policy and other stakeholder communities. Science policy engagement spans different sectors, not just a matter for action by health policymakers, but requires an emphasis on health, as you've heard, in various other sectors: agriculture, urban planning, transport, energy, environment, tourism, and so on. And it spans the levels of governance. So some actions, such as for the nationally determined contributions or national adaptation plans, but by definition are focused at the national, maybe even local levels, but others that are better addressed by regional collaboration in order to address common transboundary threats, bring together critical mass for responding, ensuring that action in one country or region does not lead to adverse consequences elsewhere. And these examples are discussed in more detail in our reports. And some of the priorities shown here for climate finance, climate research, climate justice must be prioritised at all levels of governance, public policy making. That's national, regional and global. And to do this, health and health equity must now come to the foreground in all climate change discussions. This is an important task for COP27 and other intergovernmental activities. And it is an area where we think that IAP can continue to help lead the action. And brings me to my final slide. Of course, the work does not stop with public report. The distinctive design of the IAP project is helpful in enabling continuing follow-up at all levels via national academies, their regional networks, and IAP as a global body to communicate the evidence, to stimulate discussion, to hold policymakers to account at these various levels, national, regional, and global. And I hope that later on we might go into more detail to explore how academies in particular can help lead the scientific and health communities. One of the most important distinctive features of IAP is its worldwide inclusivity in its membership. And in consequence of this, the IAP can facilitate communication of evidence and perspectives from those communities and individuals who have not always been heard previously in global discussions about these issues, whether that's in terms of designing appropriate research studies, which are skewed towards Western and Asian countries, or using the research outputs to inform policy and practice. And we hope that our reports and the global report can help to raise the visibility of the priority issues for health equity and climate justice for all. And I'll stop there and thank you very much for your attention.
Thank you very much, Robin. And as you've said, we'll come back to some of these points later also in the conversations and the panel discussions. Now, before we go to that part, I just want to quickly put attention to the two questions that have come in the Q&A. The first one on data calculation, I think I would want to push that maybe to later. So we have maybe some more time later to address this. But I was wondering, Claudia or Robin, would you maybe want to answer the question by Pascal, who's asking, can GMOs be a solution to adapt production to climate change?
Or Claudia perhaps can start off if she would like to do so.
So I think there is no single solution to adapt and mitigate climate change, but all of them need to be considered. So there are different pros and cons about the different technology solutions, but climate change can definitely contribute, particularly in the development of crops that require less inputs and are more resilient to climate change. On itself, I don't think any technological solution will solve the problems. I don't know if you'd like to take it from there, Robin.
Yeah, thank you, Claudia. I just add very briefly that issues for GMOs have a long history of controversy. I personally think that they can contribute to tackling the challenges that face food security worldwide, not just climate change. But remember also that we're entering a new era of use of molecular biosciences in plant breeding, indeed animal breeding, through more specific genome editing. And of course, that there are controversies about the use of genome editing products as well. But certainly, scientific advances show that there is promise in terms of generating new crop varieties that may be resistant to drought or other stresses, or resistant to pests and diseases, or may have greater nutrient content and so on. Some of these points are discussed in our reports and previous work from IAP and the academies. I don't want the whole of today's launch to focus on food and nutrition security, because there are many other issues, but clearly the world is currently facing issues for food security, partly from climate change, partly from the consequences of COVID on systems, and partly, of course, from the current terrible Ukrainian war. So there are issues that need to be addressed, but by innovation. As Claudia says, there's no single solution, but I think molecular biology can help.
Thank you, Claudia and Robin, for the responses. And with that, we've reached the end of the first half of our webinar, which was all about the report. And now we would like to go into conversation with other people who are working on this topic. And this part will be moderated by Jenny Miller and Peter McGrath. Jenny Miller is the Executive Director of the Global Climate and Health Alliance. And she coordinates the joint efforts there of national, regional, and international health organizations, all addressing climate change. And then Peter McGrath. Peter is a zoologist by training, and he's the coordinator of the IAP Secretariat based in Trieste, Italy. Peter, the floor is yours.
Okay, thank you, Johanna, and welcome also to Jenny, who's co-moderating this session with me, and will have a greater role in the second part as we move forward. So as has been said, we have a series now of 4 conversations, 15 minutes each, on different aspects of the report. Let me just run through them very quickly. The first one will be national, regional, global connectivity. The second on capturing diversity. The third on cross-sectoral integration. And the fourth on inclusive action and vulnerable groups. So as I say, we have 15 minutes for each of these, with one participant who's been involved in the project and one participant from outside the project. So let me jump straight in and introduce George Christofides. He's originally from Cyprus. He's an expert in vector-borne diseases, especially those transmitted by mosquitoes, and he's based at Imperial College London. He's participated in the EASAC IAP Cyprus Institute report on climate change and health in the wider Mediterranean region, and was a member of the EASAC working group. And he'll be having his conversation with Yana El-Baba from Lebanon. She is the Sustainable Development Officer with the 2030 Agenda and SDG Coordination Unit at the Economic and Social Commission for Western Asia, ESCWA. So George and Yana, it's over to you. And just a reminder, I'll be keeping time and I'll let you know when there's a minute or so to go.
Okay, thank you, Peter. Maybe I should start off So we were asked to touch upon the very important issue of national, regional, global connectivity when it comes to climate change and health, especially actions on that. So the monitoring of climate change impacts on health and its mitigation strategies is a topic that cannot bring impact unless it is addressed at the regional level, while adaptation measures in one country can educate positively or negatively adaptation measures in a neighboring country, since most problems are the same. So on this, I wanted to pass my experiences with coordinating a task force on climate and health for the Eastern Mediterranean and the Middle East region that was tasked to draft a report about the various problems, identify gaps in knowledge, and propose an action plan. So this started as an independent initiative, but we soon joined forces with the European Academy Scientific Advisory Council Working Group and the InterAcademy Partnership by co-organizing a joint workshop that led to an intermediate report published a few months ago, and then contributing to the findings about the region to the report that is launched today. So the main issues in the region that is a climate change hotspot are heat waves, air pollution, water stress, dust events, wildfires, population displacement, and spread of infectious diseases, among others, which in no way can be contained by national boundaries. So corresponding adaptation and mitigation actions need to have a regional scope and should be born out of regional collaboration. So the project started as a national initiative led by the President of the Republic of Cyprus, who was introduced to the problem and persuaded about the urgency to act by the international scientific community following an international conference. So the need for this initiative to be a regional initiative was clear from the start, as Cyprus is a very small country, heavily affected by the region, and on its own cannot make any meaningful impact. On the other hand, Cyprus is for most a politically neutral country in this very unusual region, as well as politically stable by enjoying being the only member of the European Union in the Middle East. So it did make sense for the country to lead this initiative. So possibly the most critical point is that the initiative had two distinct pillars. So the scientific pillar led by a research organization, the Cyprus Institute, and the political pillar that was led by the Cyprus Ministry of Agriculture, Rural Development and Environment. Each pillar was tasked to reach out to their respective regional communities and institutions to achieve true regionality. The leaders of each pillar coordinated with each other without compromising the autonomy of each part at any stage. And an important precondition was that national agendas must be kept out of the various reports. So from the scientific part, a great number of over 150 scientists from the region came together to form task forces, including the one on climate and health that was coordinating. And after a year of intense workshops and meetings, each task force produced a comprehensive report of scientific evidence and recommendations. The involvement of international institutions such as EASAC and IAP was very important in increasing the reach and guaranteeing the objectivity of the initiative. From the political part, several binational meetings between officials were followed by a regional ministerial meeting to agree on the framework and time plan, which were then presented to the UN Assembly as a regional plan by the President of the Republic of Cyprus. So strong political will and commitment were essential. Now, and after the completion of all the reports, a second regional ministerial meeting will be held on the 7th of June, 2022, to adopt the various reports and recommendations. And this will be followed by a heads of states meeting on the 25th of October to ratify the recommendations and plan their presentation to the COP27 as a regional initiative with a 2030 horizon. I'm finishing with my conclusion of all that, so, which is about the elements of the success. That is, the strong scientific and political leadership is needed, as well as high-level coordination regarding milestones and timelines between scientists and policymakers, but without interference regarding the essence of climate change, scientific facts, and recommendations for mitigation and adaptation. And finally, I'll give you an example of a recommendation from the Climate and Health report, which is the establishment of a regional climate and health observatory with a mandate to collate, process and make available in an integrated way data related to health impacts of environmental and climatic changes. So the need for this and for it to be regional was apparent to all from the beginning of the project, as data for the region were either scarce or withheld within the national boundaries, and thus not accessible. And without clear and robust data, we cannot monitor and make effective plans. And I will stop here and give the button to Peter and Jana for further interventions.
Okay, let's go very quickly to Jana. Please go ahead. Sorry, you're muted. Sorry.
Sorry for that. Thank you, George and Peter, and thank you for the kind invitation to be part of this event. Congratulations for having the global report out. I cannot but agree really with the point that George has very nicely illustrated, which is also a clear recommendation of the IAP report, that in order to tackle the health effects of climate change, we inevitably have to leverage the regional level. And to do so, we have to really strengthen vertical integration between different levels of governance, national, regional, and global, for, first of all, better science, but also better action. And let me illustrate the same point with another example from the Arab region. And the example is about addressing the alarmingly growing challenge of sand and dust storms in the region, which is actually one of the dustiest regions in the world due to a mix of natural and anthropogenic factors and driving forces, including climate change itself. So the impact of that phenomena is huge. The atmospheric dust loadings have wide-ranging impacts on human health, but also causing significant socioeconomic damages in several countries, estimated in the order of billions of dollars annually, really, from infrastructure to damage to agriculture, production, oil production, etc., transportation, of course. So, but these storms most often, as you know, originate elsewhere in neighboring countries, but also far, sometimes quite far away, and we have insufficient knowledge about the transportation path, the particle content, the impacts, etc., to really be able to devise the right interventions. So what do? We need really to develop our understanding of this complex phenomena, and we also need early warning capacity, but most and foremost, we need coordinated policy and sustained action in both source countries and the affected countries. And really, we have gaps in all of these three. So we have gaps in the understanding, in the early warning, and in the policy and sustained action. So luckily, in the specific case of Kuwait and Iraq, two countries of the Arab region, there is ongoing promising collaboration to really improve the knowledge and understanding of the conditions leading to sand and dust storms, their results, etc., but also action on the ground, so collaboration with field work to take mitigation actions to restore some ecosystems in the origin areas, mostly in Iraq. So what makes this collaboration and other similar collaborations possible? Of course, science, you will, IAP will agree, but so good science, but then good science that is linked and trusted by policymakers. So you really need to have on board credible research institutions with strong technical expertise, but also strong reputation that instills really public trust. A second important ingredient is regional finance. So in this case, the Kuwait fund budgeted some $13 million for that project. And that was possible because of a strong advocacy that made the case for improving health and well-being and advancing the SDGs in all countries of the region. So as UN people and all of us here as development partners, we really have to make these success factors available among other actions. And I'll stop at that and maybe switch to my partner in this conversation. George, you spoke of the importance really of upscaling national initiatives to the regional level. Do you see the Cyprus Climate Change Initiative becoming international?
George, it's your turn to be.
Yeah, it's my turn. Sorry for that. Thanks, Jana. That was a very nice example you brought with the dust, by the way, which is affecting the entire region, and there's no data early warning systems to do that. Now, to turn to your question, so as I said previously, a head of state meeting of the countries in the region is now planned for October, and already several countries outside the region have expressed interest or agreed, in fact, to act as observer states, including the United States, the United Kingdom, Australia, and the Vatican, among others. In the next months, more lobbying and persuasion will hopefully bring more countries and international institutions, such as the United Nations and others, on this table to act as not only as observers, but also in a way as guarantors of the implementation of the adopted plan. The Eastern Mediterranean, the Middle East, is a region with huge stakes, as you well know, and many stakeholders. It's one of the main fossil fuel producers and exporters in the world, as well as a key producer of black carbon that has a warming impact on climate that is on average 1,000 times stronger than CO2 itself. Therefore, the implications of such a robust plan will be global and not only regional. Also, water stress in the region is projected to lead to the greatest ever population displacement problem, with millions of people predicted to migrate to neighboring region for survival. So yes, I mean, there's a scope and need for upscaling that to the international level. But perhaps I should extend the same question to you, Jana, on what you think the role of the UN can be in achieving regional connectivity, but also in elevating such regional initiatives to the international level.
Well, actually, the ESCWA, as the regional arm of the United Nations, has exactly that mandate, you know, to really link actions from the national to the global level. And we do that in several ways, by facilitating knowledge sharing and peer learning across the region, but also across world regions. So just to give an example, so ESCWA and our sister regional commission in the Asia Pacific are presently co-leading a UN coalition on sand and dust storms. And that coalition commits the UN system to support member states really at all levels. But another thing that we are good at and we can help with is that we strengthen the regional position globally. So by relaying the right policy recommendations to our member states in the various global and UN conventions like the UNFCCC and others, we really make sure that their voices are heard globally and they can influence the global agenda. So over back to you.
So maybe I'll jump in with a question. Thank you for these really interesting examples and really inspiring examples. I'm kind of struck that kind of when we look at the global level, the UNFCCC does have kind of both the political pillar and the scientific pillar. We have the IPCC reports, we have the Paris Agreement and the UNFCCC, the COPs and the COP process. And yet we've not seen that deliver at the level that we would really like it to in terms of, you know, really driving the solutions at scale that we need to, at the level of ambition that we need. And so looking at the success examples that you're describing, what's different about those? Does it have to do with the scale? So is it easier to work at the regional level? Are there, you know, you had countries coming in with a political will already to collaborate. Can that be translated to other regions? Can that kind of political will be cultivated? I mean, what made it work? Is it the focus on a particular more focused problem? What do you think made it successful in contrast to some of this, you know, the larger process where we're really still struggling?
Just to say we have 2 minutes left, so we need 1 minute each.
Exactly. Very quickly, I mean, I agree with you that multilateral action has not delivered as the promise it wants to achieve, but we call this the science of the possible. What is possible is that, as you actually rightfully said, that when there is a focus on a specific issue where clearly, I mean, the science clearly points to damage to well-being, that is, so countries that have been previously actually really not on very good terms, like Iraq and Kuwait, can really collaborate for a common objective when these success factors that I mentioned, like the right science, the right funding, etc., is made available. So I'll stop at that.
Yeah, and I actually don't have much more to add to what you said and Jana said, Jenny. So I think scale is very important. When the stakes are multiple and many countries are involved, I think we are losing the focus really. Whereas a smaller scale can really focus on the problems. And the other one, which I thought about the question actually before myself many times, I think that have a scientific leadership and close coordination with the policymakers is very important. But the scientific leadership is really important to drive that forward because there's no interventions. I mean, we know in politics there are interventions all the time. There are new, situations created every now and then, and we need this scientific drive essentially to push that forward.
Okay, thank you very much to both of you, for Jenny too. I think we have to move on. If I can sort of pick a phrase out of this, it wasn't actually mentioned, but this concept of science diplomacy, I think, connecting the scientists to their own governmental systems and between nations, I think could help summarize this a little bit. Okay, so thank you, George, thank you, Jana, and let us move on with our next pair of discussants. So the next 15 minutes will be dedicated to capturing diversity. We have Shabana Khan. She is the director of the Indian Research Academy in New Delhi in India. She's a lead author for the Nexus Assessment Report of the Intergovernmental Platform on Biodiversity and Ecosystem Services and an alumna of the Global Young Academy. She will be talking to Omnia El Omrani, a medical doctor at Ain Shams University Hospital in Egypt. Amongst other things, she served the International Federation of Medical Students Association for 6 years, where she coordinated advocacy work on planetary health and climate change with WHO, the UNFCCC, and the Global Climate and Health Alliance. Shabana, you were also involved in the AASSA study for this IAP project. So over to you. Thank you.
Thank you so much, Peter and Jenny, for moderating the session. So my topic is to cover the diversity in vulnerability. So as we all know, vulnerability is a very important component of all disaster risk. And in recent also, we have just noted in the COVID response that people who suffered most were the people who were elderly, migrant, or the poor, or the people with already pre-existing medical situations or limited social support. So these are the people to whom in general we classify them as the most vulnerable group. But when we talk about climate change, because the impact of climate change is going to be very different for different places, different communities, the vulnerability, even though we all are vulnerable, our vulnerability is very different from each other. So we are not all of us vulnerable to the same hazard or in the similar fashion. So who is vulnerable to what kind of impact, and how to integrate these vulnerability when we are talking about planning for adaptation or mitigation measures is a very critical question. And I think IAP Global Report does a very good job in terms of highlighting not only the general vulnerability aspects, but also very specific vulnerability from different regions. I think Omnia will be elaborating shortly in about how about diversified vulnerability from different regions. But here, just to take an example, for example, in Asia Pacific region, many of the small islands or even coastal areas, particularly the megacities, they are exposed to sea level rise and groundwater salinization, coastal flooding. And here, even though millions of people are exposed, but who are more vulnerable are the people living in slums or the poor or the migrants, who are not just facing the recurrent events from these climate change, but also they are exposed because they tend to occupy hazardous locations. They are exposed to various communicable diseases, and due to their low adaptive capacity, their resilience is going to be eroded over a period of time. And if we compare with other regions, their vulnerability is going to be very different from the farmers or pastoral communities from Africa, who are likely to suffer a longer dry spells or drought and flooding and food security issues, which becomes further complicated due to ongoing conflicts and poverty. And similarly, in many other countries from Europe and Americas, it is like people are already facing health issues relating to bushfire, chemical fires, and as well as extreme heats. So while these diversified vulnerabilities have been addressed in the global reports, the role of regional academies become important because they not only have a greater access to the local information, they understand the local situation or regional situation better, but they also tend to have better outreach. And here, when we are talking about diversified vulnerability, we are not just thinking about reducing these vulnerability, but we are also looking into how our adaptation and mitigation measures can better address these vulnerabilities. Because it's important that when we are proposing new solutions, they should not trigger new kind of vulnerabilities, right? What we have noted in global agreements, whether we talk about SDGs or SFDRR or UNFCCC, holders participation, and also mention the participation of different vulnerable groups, but hardly they provide any structure. And what does that mean is it comes as a barrier at the local level or regional level. So I think these issues can be addressed at the regional level because sometimes the number of vulnerable groups in any area could be very less, and that get missed out in a global scale. So I think regional scale can be a better scale where these issues can be addressed. And it is important to address them because we are not simply talking about the representation of vulnerable groups in planning, but we are also talking about their active participation in decision making, and also that their choices are respected. So when we have that, it means that the overall process of planning, adaptation, and mitigation slightly become complex. But at the same time, the benefit of this tend to outweigh the cost of the process or all the nitty-gritties that we may have to go through, because ultimately what it will result into is we will have more options for response rather than few, right? And it will also benefit in terms of right, not only engaging different section of the society, but also having local responsibility, accountability, as well as solution that the community can own and participate effectively. And I think it will also have benefit in terms of increasing local resilience. So I think capturing these diversity is an essential element, and I must congratulate the IAP report because it addresses it so powerfully. And I would now invite Omnia to bring those regional differences, particularly in terms of health. And so, welcome.
Let's go ahead, Omnia.
Yes, thank you so much for having me. That's the first of all. And in terms of diversity, I see it reflected from two different aspects. One is geographical and regional diversity, and the second one is intergenerational. So thinking about the age group participating in climate action and health. In terms of geographical diversity, I would like to share my experience working, as mentioned, with the International Federation of Medical Students Association, a federation that represents students from over 120 countries around the world. And we were able to reflect diversity in the issue that we advocated most for, which is climate change and health. We were able to do that by looking at what young people and young healthcare professionals are doing in their own countries and the diversity of challenges that they are addressing. And on the other hand, we were able to engage in a way that is diverse and inclusive as many young healthcare professionals in the work that we do when we, for example, attend the climate change conferences at the UN or the World Health Assembly and so on. What I've learned looking at what different members from different countries are doing. I saw how, for example, young healthcare professionals in Rwanda, when they're advocating for climate change and health, they're focusing on access to safe water and sanitation. And then when students in Brazil, for example, are advocating for climate change and health, they're looking at deforestation. When we're going back to countries in Europe, like for example, the UK, they're looking at air pollution and ending fossil fuels. So each country has its own challenges, and it's important to have a diversity and an inclusive lens when we're advocating for climate change and health. Another important aspect that diversity must be integrated within is the issue of awareness, understanding, and capacity building. And this is a reflection on my region. I come from Egypt, which is part of the MENA region. And recently I worked with the World Health Organization, where we did a report on assessing all the available data on climate change and health in the past 10 years from 2010 to 2020. And we categorized it according to regions. And the region that ranked the least was the MENA region. But this does not present a challenge for us as much as it presents an opportunity, because the next UN climate change conference is taking place in Egypt, which is part of MENA, and then the next one, which is COP28, is going to be in United Arab Emirates. So this again shows that we have the opportunity to build our capacity, because two of the key events of climate change are happening in the region. So it's also important to think about how intergenerational diversity can also be integrated with climate action, the importance of thinking and putting diversity not just within the research that we are doing and the generation of data, but how we can bring gender sensitive and diverse data into policy asks, into implementation, and also recognize the challenges that each region is going to face, and most important, build capacity. I see the importance of diverse inclusion of voices, especially in climate policy making, diplomacy, and shaping of intergovernmental meetings and conferences. But what's more important than just inviting diverse voices to participate, it's also building their capacity and their technical understanding of what climate change and health implications are, how they can utilize the health argument for climate action and for bringing the urgency, as well as persuading their own countries and their own member states to take action. But it's important to make sure that the data that we are generating is also can be adjusted, can be understood by diverse regions, thinking about all the barriers that they would face in terms of language, in terms of culture, in terms of access, simple access to data that is needed. But I'm also agreeing in terms of what Dr. Shaman has touched upon, which is integrating vulnerabilities, and also speaking from a young healthcare professional perspective that young people and women and children are also more vulnerable. That is why we also need the voices of young people, not just to be integrated, but to be working together, youth-led organizations, with civil society organizations, with intergovernmental organizations, highlighting the importance of diversity and inclusivity, but with an action-oriented lens, how to put our perspectives of diversity into action. And I think that health and climate change presents the perfect platform and the perfect example to both ensure that diversity is sustained and at the same time drive climate change and climate action towards a more inclusive, equitable actions that are either taken at the climate change conferences and beyond this as well.
Thank you both. It sounds like there's a lot of agreement here. I wonder, Shabana, if I could prompt you, you were part of the AASSA, the Asia report. Can we do things better as a network of academies? And can we learn from the past 3 years on this idea of inclusivity?
Yeah, definitely, because I think it was, for me also, it was the first experience to work on a regional, to be a part of a regional academy and work on the regional report. There's so many things, even which we take it as granted, like we know. So for example, in my case, I knew what is vulnerability, already have worked over a period of time. But the moment you are looking the same issue at a different scale, the dynamics of vulnerability changes. So there's so much to learn. I also reviewed the African report of IAP, and it was, again, there's so many different aspects which got highlighted and which only appears at the regional level. So I think that collaboration, not just within within region, but also across the region is essential, so that we can learn lessons from each other, and it widens the perspective and how we can address, because some regions are handling the same issues much better way than the other. So there, I think a lot of lessons can be transferred from one region to other.
Okay, thank you. And I think, Jenny, you have a question just to wrap up. We have 2 minutes and a little bit. Thank you.
So I just want to invite you to kind of reflect on the previous speakers talked about the importance of shared data within a region to drive shared solutions. Both of you have referred to the challenge of insufficient data and the need, some regions and some countries have different, amounts of data and inadequate access to data. But you also talked about the real importance of community level data, diverse voices, inclusive data, input from those impacted. How do you reconcile, and could you reflect on that need for joint and shared data and that need for inclusive and diverse data? Can you speak about that a little bit in the couple minutes we have left?
Why don't you go first, Omnia?
Yeah, I think that this is a very important question, because I believe that I see that this is the responsibility of global organizations that tend to develop data and research from a much more advanced lens, but at the same time working with the community is a way that achieves two things. The first is that by working with the community, with young professionals and with activists that are passionate about climate change and health, asking them to reflect on either peer-to-peer data or assessments or questionnaires and so on, and having the data led by the community is the key to making sure that this data is inclusive and is representative of the challenges that are faced. And on the other hand, this is a win-win solution, because when data is generated by the community and by the country itself, it helps advocates to spur action, because this is not just data that has been generated, it's generated by the people of the country. So I see that also brings in the importance of building capacity, because for us to advocate in our own countries about the issue of health and climate change, we need data that represents the challenges that our countries face, so that we can drive policymakers to see it as an urgent issue. And based on this, we can also work together to develop solutions and to co-create actions that can be sustained further on and that can be evaluated. Also, by collecting data, we are subconsciously bringing in the urgency of the issue by also engaging more people in understanding and in prioritizing the issue of climate change, where it is not yet a priority seen in many countries around the world. But I also leave the floor to Shabana.
Thank you, Omnia. And any last words very quickly, Shabana, before we move on?
Yeah, I totally agree with Omnia, and data problem we have more in developing countries. So I think engaging community and for the data creation is definitely a good idea, but there is also a need for creating a repository where actually this data is not only stored but also sustainable, and it can be used for later references, and I think that is the way forward. So thank you.
Okay, thank you very much. There's interesting discussions during this on the idea of capturing diversity, and I think this last point on data sharing will also flow through to the next conversation 3 on cross-sectoral integration. Let's see. So here, let me introduce Deoraj Kosi. He's an epidemiologist and a member of the Mauritian Academy of Sciences, and he was chair of the NASAC working group for the African Regional Report. And then we have Luis Augusto Augusto from the Center for Global Health of the Fundação Oswaldo Cruz in Brazil. And he also has an appointment as an adjunct professor at Georgetown University, Department of Global Health in Washington, D.C. He's also a member of the steering committee of the Sustainable Health Equity Movement. Deoraj, the floor is yours.
Greetings. I'm honored to be part of this group, of this important discussion that's taking part of issues that were identified at regional level, feeding into the global issues. The point I want to raise is about the intersectoral collaboration. We have heard from previous speakers that the negative health impact most invariably arise in non-health sectors, such as transport, energy, agriculture, urban planning, and others. So it's stand to reason then that these sectors where the pollution is arising, that produce greenhouse gases, that in turn have adverse impact on the health, should be addressed at the root level. So we should be conducting joint exercise during planning, implementation, and monitoring. But when we look at the data of how it actually happens, particularly in Africa and elsewhere in the world, you see that the sectors are often working in isolation. The Ministry of Environment, where most of the pollution's problem are addressed, when they submit the NDC, the nationally determined contribution, health is often excluded. Recent study in the Lancet shows that in Africa, compared to the rest of the world, health is mentioned in the NDC. In fact, even mentioned even more than it is in the US or in Australia. But that is, I think, lip service. Mentioning health doesn't mean you have action included to address it. What is missing is real action. We are not seeing joint planning. We are not seeing joint monitoring or implementation. Why is that happening? Is it because we don't have the tools for doing it? We don't have the capacity for doing it? We don't have the knowledge for doing it? We're not aware of it, or we're not convinced of it? What is the issue? Well, as far as tools are concerned, we have many tools. In the Afro region of WHO, this was recognized way back in the Libreville Declaration, in which the environment and the health sectors are supposed to work together jointly in planning and addressing the adverse effects of climate change. And to help achieve this, WHO has come across with the VAA, the Vulnerability and Adaptation Assessment. That again is a joint exercise, goes step by step, where each sector sit down together, they identify what the issues are, and then they set down how to address it, how to prioritize it. So the tool is there. And then we in the NDC, but the result is not there. So what is it? Some study done, and more remain to be done, more research remain to be done. Where is the bottleneck? The bottleneck is the capacity. Countries don't have the capacity to undertake it. The policy document that is existing now from WHO and the tools, they're almost like a cookbook recipe. You know, recipe without an ingredient doesn't feed the stomach. And that's what is missing. We are missing the know-how. We're missing the next stage. And I think the report that we have produced contains very succinct recommendation for policy level to sensitize the policymakers, to set the stage for dialogue, and to start the intersectoral going. I think I'm going to stop in here and let my next speaker take over.
So over to you, Guto. I think you're joining us from the World Health Assembly, is that correct?
Yeah, that's right. So I hope you can hear me well. So it's a little bit noisy here. The only place I find was in the entrance of the Palais. So thank you very much, Peter and Joanna, for the invitation. Also, I want to thank Professors Volker and Haynes for the leadership in this important and long-term process. So very nice academic exercise. The report methodology, objectives, and regional and global outcome in itself is a good example of the need to searching for intersectoral collaboration to advance climate change and health agenda. So when we read it and we start learning from the methodology, so what is the challenge and what we can do about that. Also, there are very interesting points from the regional report. I just want to mention one is the IANAS report that identifies as a core recommendation to include global south regions that are not well represented in the existing large body of evidence on climate and health, which is also, you know, many other people have talked about that, but that wasn't in a report yet. So it's a very important point. So I am currently here in the WHA, and yesterday you have this briefing with Dr. Mazzucato from the Economic Commission for WHO, and that she talked about something that's very core for this same session. So that's why I picked it up, and she says we need to focus less on the existing sectoral silo system and focus more on the results we want. And I think that's a very important point. So in my own experience, I see that it's much more productive when we spend time describing and articulating common grounds around, you know, many people and many different responsibilities, than to create policies that are embedded in all sectors' commitment and all sectors advancing for having intersectoral integration, then trying to mend and articulate sectors that doesn't was conceived as an intersectoral policy. So it's you lost a lot of time in that. And I think the report shows it, because it shows in the introduction, thanks for all this nice introduction, the point was made. So there are other sectors that have advanced much more and is much more visible. Even we know health is the one that will be suffered the most. So that's a very good example too. That's bring me to the point of the equity. So I think one point that the report makes it very clear is this common ground of equity, that equity should be one that focuses to advance knowledge that promotes health, climate, justice, and cross-sectoral integration. So it's all together. And I want to just give an example of an area I've been more working in the last year ago, is the homeless and the climate change. So citizens that are in homeless situation are more susceptible for health effects. Health climates such as heat wave, mental health, nutrition affect much more the homeless than anybody else. But also to solve this problem, we have seen now, as you know, with the COVID, that is an area that has been called attention. To solve it, you need an intersectoral authorities, population, academia, local, national, international community to act together, because it's a big challenge and it's not easy to solve. Actually, you need this thinking based on all for health. Many people say health in all policies, but I may, maybe it's the very health for all policy. That's maybe the way we need to go. And having common needs, integrate solutions, and solve problems that innovate policies. So you can actually have an innovative policy that actually put all these things together. Finally, I cannot say how important it was to see the data in the report. That reminds of the importance of have a very good core data, core evidence on how to establish, this set of indicators we can measure effectiveness and advancement, which has been done actually by the Lancet countdown, but it's actually something somebody already talked here. We need to improve the data quality everywhere, and also use some of the digital data is available, and the report actually points for that. So this report brings important information about existing evidence, gaps of knowledge, and examples of solution. It's indeed excellent start for these post-COVID times, where we all need to recover better, more sustainable with social justice and peace. Thank you very much.
Okay, thank you. DRS, you have any responses to that or further questions for Guto or Jenny? Be ready to step in.
I think, Jenny, you want to go? I have one response for Augusto. The issue of vulnerability in intersectoral is very important, because we can exclude the vulnerable groups. the gender, for instance, the homeless, when we're designing our intersectoral collaboration. And this is one sector that's very often left out. Eventually, health and environment do talk a little bit because the money has to be divided or has to come one way. But gender, unless the government has very specific agenda and they want to stream it in, it tends to be left out. So that vulnerability, not just for gender, but for disabled, for people who are most exposed, has to be factored in when we do the intersectoral collaboration. Thank you.
Actually, the next conversation after this will go into a detail in those vulnerable groups. But Jenny, over to you.
Yeah, thank you. I think I may have been in the same session that you were, Louise. I also was struck by that reframing of a focus on the goals and then figure out what needs to happen from there rather than starting from the sectoral perspective. But my question is around the challenges of taking sort of a health in all policies approach or a health and equity in all policies approach. Because when you do that, you know, each sector has its own language, its own practices. Sometimes there's the challenge of competing for attention, competing for funding. So I'd love to hear your reflections on how we overcome some of those challenges and actually get people to be working on the same goals, given the diversity of the different sectors and some of those challenges to working together in that way.
Yeah, this is you point out a very important. So the system is working in silos, so it's not easy. So you actually need to kind of a revolution to change it. But we have some very important thoughts. So if you're looking what's happened during the implementation of the Framework Convention for Tobacco, where you have, you know, a focus on a free smokes environment. And that make everybody move in that direction. And that was a very complex because you have political, you have legal framework need to be changed, you have a commercial interest in that, you have restaurants, you have movies, you have cars, you have transportation, and that succeeds. So actually is one of the very, you know, important example we can say. Of course, there are a lot of things to do, but is a good example. The other good example is during the COVID. So when you focus on something, on some results, you actually can, you know, get off of this. But this is not sustained. This is the problem. You know, that works for a short term, but doesn't work for long term. I read an article a few weeks ago. I use in one of my courses in climate change in Georgetown, and they say, you know, we are kind of naive if you not talk about the realpolitik. Because one of the problems to change is not only knowledge. We sometimes have a lot of knowledge, have a lot of articulation, have, you know, all the important people on board, but we don't have the realpolitik, which actually change the world. So we might need, and this is in the report, in some other words, is point out what we need to search more, have better evidence at local level, in the how that the process is coming on. And we can work in the realpolitik. I think that might have some results. Thanks for the question, Jenny.
Well, let's come back to that point on breaking down silos and the realpolitik. Dheeraj, do you have any final comments on these points?
Well, the challenges are the challenges. I mean, I have worked in so many countries around the world. I have found in some countries it worked really well, seamlessly. Especially in countries where resources are limited and the country is small, they have to sit together to compete for it. But in bigger countries, this doesn't always happen. And I'm not saying the fault, but some of the issues are the donors. The donors, they give money, big amount of money, and then the one who's going to compete for most of the money, the reduction of greenhouse gases, are going to just go in a silo and do it alone. But we have to be convinced of the co-benefit. Really know that what we're doing is going to make a difference. And then that's going to happen. So like all development projects, in many development agencies, like USAID and DFID, they require to have a gender component in there. They require to have a health impact assessment in there. That is a requirement, or the funding will not take place. So we have to maybe advocate at that level, because the money is coming, people are going after the big apple, and they're bypassing what is in front of them, the co-benefit. And that's not an easy challenge to overcome.
Okay, thank you. Thank you both. I think we have to draw this particular conversation to a close there, but I think we've finished on some important points, that there are best practices out there for, like Guto mentioned, the tobacco one and some others, and maybe this is a point that IAP and the academies can pick up on moving forward to try and identify those. Okay. So let us move into our last conversation. We've touched on it a little bit just now. It's on inclusive action. I'm talking about vulnerable groups. Let me introduce the two protagonists. We have Christy Eby, Professor of Global Health and Environment and Occupational Health Sciences at the Hans Rosling Center for Global Health in Seattle in the USA. And she was a member of the IANAS working group, that's the IAP network for the Americas. And then we have Amara Dagbadoj, who's a physician who specializes in maternal and child health and health policy. She works at the Parliamentary Research Institute in Mongolia, where she undertakes health policy analyses. She's also an alumna of the IAP Young Physician Leaders Program. So Christy and Amara, over to you.
Thank you very much. It looks like I'm muted on your end. Can you hear me?
Oh, all good, we can hear you.
Oh, good, great. The symbol on my end looks like I'm muted. But thank you very much. And thanks to all the panelists that came before. The presentations were really exceptional. And much of what I'd planned to say has already been covered. So I'll just cover a few things so we can have a longer conversation. We've heard all the compelling reasons why we need to ensure that vulnerable groups are included as we plan implementation of whatever actions we're looking at, whether it be adaptation or mitigation. And we've heard about the possibilities for how we can go about doing so. We do have long experience, particularly in the side of climate change research around adaptation, on co-design and co-production for adaptation. So there's a lot that we can draw on how we work directly with the vulnerable communities in really identifying the needs from their perspective and identifying the valuable approaches to help address their multiple vulnerabilities. Because of course, it's not just climate change, that we do have to reduce inequities, we do have to take into account so many other constraints within the vulnerable communities. We have processes to do so. And I would like to broaden a little bit the discussion. We heard very good remarks about the sectoral collaboration. We also need to think about how we do our interventions within a region. We're all giving examples from our region. I'll give an example from mine, the place that I live. My governor needs to, over the next few months, think about wildfires, drought, heat waves, and sea level rise. We have different vulnerable groups for each one of these. So vulnerability mapping, which has been mentioned, of identifying the overlapping vulnerable groups to the wide range of risks we're facing within a region, is very important. We can use some of the principles of implementation science to go about using that information, working with the trusted voices to make sure that we are in fact addressing the needs both today and in a very different future. And making sure as we do so that we can connect across the scales, as everyone has been saying. We all talk about connecting cross-sectorally across scales, and how one does so varies with the region, that every place does have a bit different governance. It has a little bit different approaches to addressing a variety of challenges. We have the opportunity to build on all the work that's been done within climate change. All countries now have some form of national climate change team, and being able to work with those teams because they can help build those collaborations. In many countries, they've already been well established. So we have a place from which to build. One area we do need help with is from funders, that these kinds of approaches are not typical for health funders. It's becoming much more typical for funders in ecosystems and in other fields. And so ensuring that the funders understand that they need to think somewhat differently about how they go about funding research and implementation in this area. And the final comment I wanted to focus on is, as we go about doing that research, we need to understand the synergies and the trade-offs. And they may not be what people expect. There are projections, for example, that the lower the emission pathway we follow, that has more biofuels in it, the less land there's going to be for agriculture. And that, of course, means higher prices, and that's going to differentially impact the poor. It doesn't mean we can't go to biofuels, but it definitely means that we have to, in advance, do the research and do the modeling so that we have an understanding of what those trade-offs could be. And we work out in advance how we're going to manage those trade-offs in partnership with the vulnerable communities, so that we do have more biofuels, but we don't increase food prices. We have agriculture sufficient for everyone, and the impacts do not fall primarily on those who suffer the most at the moment. With that, I look forward to further comments. This has been a very rich discussion, and looking forward to hearing some details about Mongolia. So thank you very much.
Thank you, Christy. Amara, please go ahead.
Thank you. So I would like to comment the IAP global report, especially on the issues of Asia and Oceania. As the report says, Asia and Oceania are considered to be the most vulnerable continent to climate change and the most disaster-prone area in the world. Yet 60% of the world's population live in these continental groups. Asia is also very diverse. There are several landlocked nations, coastal countries, and countries with vast areas such as India, China, and Mongolia. As a representative from Mongolia, I would like to introduce the challenges facing the country. Mongolia is a landlocked country with a high altitude. It's characterized by a strong continental climate with vulnerability to the extreme climate phenomenon, such as drought in the summertime and drought in wintertime. It's already a very dry country where some regions experience no yearly rainfall at all, and it can lead to severe drought events. Mongolia's annual average temperature has increased 3 times faster than the global average, turning its grass-covered steppe into desert and melting 40% of its glaciers since the 1990s. Exceptionally dry summer is making winters even more dangerous, as extreme weather events kill the livestock. It's called the drought. The frequency of the drought has been increasing since the 1990s. Disasters like this are forcing more and more herders to leave the steppe. Most end up in capital city. Hundreds of thousands of them set up gers, known as yurts, on the city outskirts. Therefore, the most vulnerable groups are nomadic herders, women and children living in urban ger settlements. Firstly, nomadic herders are increasingly under pressure from extreme climate events. Those who couldn't overcome climate shocks often move to urban informal ger areas. And ger areas has limited access to government services, poor living conditions, and limited income opportunities. And it's enforcing a cycle of vulnerability. Secondly, children are the most vulnerable to the adverse health effects of air pollution from the day they are conceived. Pneumonia is now the second leading cause of under 5 child mortality in the country. Children living in a highly polluted district of central Ulaanbaatar were found to have 40% lower lung function than children living in a rural area. Thirdly, within their settlements, poor living conditions, air pollution, and environmental degradation are increasing pregnancy risks and leading to a rise in the mortality rates of children under 5 years old. So Mongolian government has adopted a series of policies to mitigate and adapt to climate change and focused on vulnerable groups. These include the National Action Program on Climate Change, National Green Development Policy, and Vision 2050. Areas of national priority include arable farming, water and forestry resource management, and biodiversity. However, the implementation progress is very slow. For example, the issues that were discussed in 2015 are only now starting to get implemented. To speed up the process, first we need to acquire information on perceptions of climate change among people within the framework. This will clarify our issues, whether it's from lack of knowledge or attitude, or whether lack of policy support. The scientific community can help to bring these issues to the attention of regional policy bodies by documenting climate change and associated public health issues. Then simplifying some of the research data available to policymakers. I work at the Parliamentary Research Service of Mongolia, and for the last 2 years, no policy analysis has been done with regards to climate change. It's clearly showing passive attention from parliamentarians. Therefore, scientific community should take action towards this issue.
Okay, so thank you for that, Amara. I mean, I'm quite impressed that you seem to have a perfect storm of climate change and health impacts in Mongolia, but the policy analysis is totally lacking. Let me pass to Christy for maybe any sort of comments, and bring in Jenny after that. Thank you.
Thank you. That was really interesting. And you do have a lot of challenges. I've also heard you've made good progress. So it's both the fact that you have so many risks that you're facing right now, intersecting climate change and vulnerability and other development issues. You've got rapid urbanization, you've got a number of challenges in Mongolia. But from the outside, it seems like you have made some progress. And to think about what were the factors that got you here? How were you able to build on your institutional structures, your close-knit scientific communities, to be able to make some progress, acknowledging you've got a long way to go?
Mongolia has made some progress on the developing the National Action Program, and in accordance with the international recommendations, but the implementation process is very slow. And I agree with your point previously said that we don't want to increase the prices for the environmental friendly solutions because of the vulnerable groups. And in Mongolia, we have 30% of the population are nomadic herders, and also the their settlements in Ulaanbaatar, the capital city, is taking up almost 60% of the capital city population. So it's clear it's a important problem. Well, how do we implement these action plans, and how we make sure these plans are down to earth and not affecting the vulnerable groups?
Thank you.
Jenny, I'll pass to you for any final remarks on this conversation, and then maybe we need to move on.
Yeah, no, I think this is really highlights the differences in the way climate change is experienced around the world. I think one of the things that jumps out at me in thinking about this dialogue, and then earlier when we were speaking with Shabana and Omnia, is that call for inclusive planning and bringing communities to the table to be part of the solution process, part of resilience, becomes very challenging when those impacts really are already hitting home. So I think that's maybe a challenge for further discussion, is how do we have inclusive decision-making processes and so forth when communities are already being severely impacted, and how do we continue to ensure that their voices and their leadership and rights and decision making are being honored, even while protecting them in the face of these really difficult impacts. I think as we're getting on in time towards the end of our time together, maybe I could just turn back to Andy Haynes for a brief final remark, and then before we go to the closing remark. So Andy, these various conversations have really highlighted quite a range of ways in which we have to work in a more integrated way, whether it's local to regional to global, or across different kinds of data sets, across different kinds of populations. How do we tie that all together? How do we do that work? Thoughts on that?
Of course, this is the big challenge, isn't it, for the future? How do we span these disciplinary and sectoral silos? Because most societies are not set up to do so. I don't like to think that the IEP initiative in its way was breaking down disciplinary silos, because we did involve the science academies. It's not just health. So there are many other scientists involved, and we have to learn each other's language, because different sciences communicate using different terms. And so that's step one, is learning each other's language. But when we're talking to policymakers, they also work in silos. And so we need to look at governance solutions, which mean that we need to bring in colleagues from the social sciences, the political sciences as well, to try to understand how we can create governance mechanisms which are fit to tackle these planetary health problems, obviously climate change being the main one. So that is a tremendous challenge, but it's one I think we have to rise to. We have to understand at what level is the best one to actually act for different objectives. So, for example, some things have to be done at the national level. The national government has to set the regulatory framework, but some actions can be taken at the city level, where city decision makers can make important decisions about different sectors. And often they can bring the sectors together in a much more intersectoral way than the national governments do. And we need more scientific input, I think, working with mayors, city leaders, and so on. And we and others are beginning to do that. So I think this is a potential objective, perhaps, for the IAP in the future. Another thing I took away from this was the need for systems thinking. There's no point in just having a single intervention, which, by the way, might have some unintended adverse consequences. We need to think in terms of systems. How can we get multiple benefits? How can we avoid disbenefits and trade-offs as much as possible? And how can we make sure that we don't leave the poor behind, that we actually accelerate development for those most deprived and most vulnerable communities? And that takes systems activities, which is a challenge to traditional scientific reductionism. I think also we need to link the resources, don't we, to the goals. And I think that's where we need to challenge the funders. The climate funders need to be thinking about health and broader development issues as well. And development funders need to be thinking about climate and health. So perhaps the scientific community needs to challenge the way that the funders are also thinking in a very reductionist way. We didn't talk much about loss and damage, but that's going to be a big issue at COP27. And many countries are going to be raising the fact that perhaps the high-income countries bear a disproportionate share of the responsibility for the climate change that we're observing. So how can science contribute to that? And some of the work that's happening now on detection and attribution enables us to actually say these climatic events wouldn't have occurred without human-induced climate change, and therefore their health effects must be due to human-induced climate change. And I think that's a big area for scientific research in the future. And finally, this emphasis on involving citizens, co-design, and citizen science more generally. And how do we actually raise the kind of level of the knowledge of science or the practice of science for citizens more generally? So I think engaging citizens much more in the design of solutions is going to be absolutely crucial. Integrated solutions, which engage us both in adaptation and mitigation simultaneously. So in conclusion, I would like to say that I think many decision makers see science and research as a kind of luxury. And I think what we've tried to do is to say it's not a luxury, it's absolutely essential. Because if you don't engage science and research, you will make decisions that will have unintended adverse consequences. You will not achieve what you want to achieve. And I think that doesn't mean to say that we need to wait for the perfect evidence before acting. It's absolutely that's the wrong latitude. What we need to do is to act on the best available evidence, but evaluate the impacts of those solutions to ensure that we can course correct, that we can understand what happens when you try to implement solutions on the ground. And it seems to me that's the next frontier for science, is evaluating implementation of actions, feeding the evidence back to public and policymakers and the scientific community more generally. And that's the way we have to proceed for the future if we're going to tackle these very, very pressing challenges that are confronting humanity. Thank you.
Thanks, Andy. Thanks to all of the fantastic panelists. Peter, it's been a pleasure co-moderating with you. And I think at this point, we get to hand it back to Volker to wrap us up here. Volker, over to you. And you are on, here we go.
I apologize. Thank you. I'm sorry. We just heard from Andy a very nice summary of our discussion and in describing the problems which are ahead of us and what we have to do. And I will not give a summary of it, but I just want to strengthen the point that it will be important for us really to continue working on this issue and bringing the different parts together, and also the parties involved, and trying, I think, to act as a moderator if possible, because the knowledge we have should be used, as Andy has strengthened it, really for future activities. So I think we should all be convinced that our work we have done is of importance and that we should continue and try to incorporate what we have learned at the moment. Well, I would actually like to thank, at the end of the webinar, all participants for joining and all speakers and panelists at discussion for their contributions and engagement. It is really my hope that we will continue, and that certainly our 140 member Academy of IAP, who have considerable experience in bringing together the scientific community and policymakers in their countries to inform science policy issues. I think one of the biggest problems is that it is difficult for us scientists to reach politics and to get in contact with them and to convince them that we are not a threat, that we are of help. And I would say this is something what has to be done. It is not enough to write a global report. It is just the beginning. And I think we should continue. And I assume that everybody agrees. Well, normally we would not have had a webinar to launch a report. We would do this in person. We would have a very nice meeting. We would come together, and we probably in a very nice location, and with the opportunity for chats and drinks and talk. And I'm sorry that this is not possible. And for me, who has been engaged in this type of work for many, many years, it is unusual, that we do this in a webinar and we cannot shake hands and cannot talk in a very small group. So I would say that I hope that the future will allow us to do this. And I would like to use the opportunity to express myself. Thanks to the 4 regional networks of IAP who were so strongly engaged in this project, in particular the working groups in managing to deliver the analysis and reports despite the corona pandemic. It is really amazing to me that we have really achieved this despite all these difficulties. I would like to mention we only came once together in person in 2019, at the end of November, beginning of December, at my Academy Leopoldina in Halle, Germany. And we have never met after this in person, only by video, only by internet. and that we could achieve this is really amazing. And there's something about the enormous disciplines the working group and the academies had, which were involved. And so it is something which is really remarkable and should be mentioned. And I would also like to thank our small coordinating group, which has facilitated the work of the network and the working groups, and have made sure that their connection could be kept and that people could interact with each other despite all these difficulties. But it is also my intention now to thank 3 persons who have done a really amazing job. This is number 1, Johanna Mokwitz. I mean, she was in charge of coordinating all project activities, including these webinars, including the Zoom's activities. And it's amazing how she has managed, always in a very nice and polite way, always willing to do, always to do overtime. Then I would like to mention Robert Fierce. He is a mastermind in writing the global report and providing support to the different working groups. He always was available, he always helped, and without him, I don't think we could have finished this global report. And the last person I would like to mention is Sir Andy Haynes. You're all familiar with him. I admire his profound knowledge on this topic and his profound advice, ever available for solving all difficult problems we had. So at the end, I think it is wonderful from my point of view that we could achieve this. And I thank all of you very much. And those who are listening, that they were keeping with us the time, and I hope they have enjoyed the discussion. This is the end. Thank you very much.